Did you know that trouble swallowing, called dysphagia, is very common after a stroke? A stroke can damage the parts of the brain that control the muscles used for swallowing, affecting how a person eats, drinks, or takes medication safely. In fact, this condition affects nearly 2/3 of all survivors of stroke, and it's more common in people who have had a hemorrhagic stroke. Swallowing may seem like a simple and natural function, but it's actually a complex process involving a highly coordinated set of actions. Let's take a closer look at the different stages of swallowing. Oral phase is the action of chewing and moving food to the back of the mouth. Pharyngeal phase is when the swallow reflex is triggered and food passes through the throat. And the esophageal phase is when the food is moved to the stomach through the esophagus for digestion. Symptoms of dysphagia may include pain or discomfort while swallowing, not being able to swallow, food or pills remaining in the mouth or stuck in the throat, drooling, coughing or throat clearing during or after eating or drinking, gurgly or wet-sounding voice during or after eating or drinking, difficulty coordinating breathing and swallowing, eating slower than normal or avoiding eating and drinking, feeling that food or drink has gone down the wrong way, weight loss, malnutrition, or dehydration, recurrent chest infections, or pneumonia. If you see someone you support showing these signs, it's important to ask for a swallowing evaluation from the healthcare team. Screening for dysphagia can include a patient history with questions around typical or before the stroke eating and drinking behaviors, monitoring for the presence of the signs and symptoms, or screening tools which include water tests and food tests of different consistencies and scales. Dysphagia screening should be completed shortly after stroke. A speech-language pathologist, otherwise known as a speech therapist, is considered the expert in assessing and treating dysphagia. They will work with you to develop an individualized treatment plan. Dysphagia treatment after stroke often includes a combination of behavioral, medical, and surgical treatment approaches. If you're a caregiver, your support makes a huge difference. Here are a few tips. Encourage slow, careful eating. Help prepare foods that match the recommended diet level. Watch for signs of coughing, fatigue, or changes in voice during and after meals. They could mean food is going down the wrong way. Keep track of meals, weight, and progress. The takeaway? Early and consistent therapy, especially with a speech-language pathologist, can greatly improve your outcomes. But for some, recovery is a longer journey that requires ongoing support. Whether you're a survivor of stroke or a caregiver, you're not alone. With the right tools and support, better swallowing and better days are ahead.